In a concerning development shaking the foundations of Singapore's healthcare system, the Ministry of Health (MOH) recently disclosed that an additional 5,300 cord blood units (CBUs) stored at Cordlife are now considered non-viable for stem cell transplant purposes. This revelation comes as a devastating blow to thousands of families who entrusted Cordlife with the preservation of these vital medical resources. The crisis began to unfold on November 30, 2023, when it was first discovered that certain CBUs stored in 7 out of Cordlife's 22 storage tanks were exposed to suboptimal temperatures. This breach of storage standards raised significant doubts about the viability of the affected units, prompting rigorous testing by MOH and its panel of experts. Subsequent investigations revealed that CBUs stored in one of the storage tanks, Tank B, as well as a dry shipper, were at high risk of adverse impact due to temperature warming events. As a result, these 5,300 CBUs are now deemed non-viable, leaving families grappling with uncertainty and anxiety about the future. The root of the crisis can be traced back to inadequate liquid nitrogen levels and monitoring failures by Cordlife staff, which compromised the integrity of the stored CBUs. This systemic failure underscores the critical importance of stringent quality control measures and adherence to industry standards in the management of medical resources. In response to the crisis, MOH has mandated that Cordlife inform affected clients and those awaiting further tests about the situation. However, the outcome of these tests is expected to be delayed by a year due to the complexity of the testing process, further prolonging the uncertainty for affected families. Furthermore, MOH has taken steps to ensure Cordlife addresses identified gaps in its governance, processes, and systems. This includes closer scrutiny of Cordlife's operations and the implementation of corrective measures to prevent similar incidents in the future. However, the repercussions of the crisis extend beyond operational failures, as legal and regulatory actions have been initiated against Cordlife's senior executives. 7 senior executives from Cordlife, including the former group CEO, chief financial officer, and acting chairman, have been arrested over concerns regarding potential breaches related to the mishandling of CBUs and failure to meet disclosure obligations. This development follows an investigation initiated by the Commercial Affairs Department (CAD) and the Monetary Authority of Singapore (MAS) under the Securities and Futures Act. The investigation focuses on Cordlife's management of temperature irregularities in a cryogenic storage tank, highlighting the potential legal and financial ramifications of the crisis. The involvement of key figures within Cordlife underscores the seriousness of the situation and raises questions about corporate governance and accountability within the private cord blood banking sector. It is imperative for authorities to conduct a thorough investigation and hold accountable those responsible for the mishandling of CBUs and breaches of disclosure obligations. As the crisis unfolds, it is essential for affected families to stay informed and closely follow updates from MOH and relevant authorities. Transparency and accountability from Cordlife are crucial in restoring trust and confidence in the private cord blood banking sector. Furthermore, the broader issue of regulatory oversight and enforcement in the healthcare industry warrants attention to prevent similar incidents in the future. Authorities must ensure stringent regulations and robust monitoring mechanisms to safeguard the integrity of medical services and protect the interests of patients and their families. In conclusion, the crisis surrounding compromised cord blood units at Cordlife highlights the urgent need for greater transparency, accountability, and regulatory oversight in the management of medical resources. As investigations continue and regulatory actions unfold, it is imperative for stakeholders to prioritize the well-being of affected families and work towards restoring trust and confidence in the integrity of healthcare delivery. Thank you for watching 2230. Don't forget to like, share, and subscribe for more in-depth coverage of current events. Let us know your thoughts in the comments section below.